we're going to talk about black triangles, okay? A black triangle is what we commonly call it, is basically a space by the gum line with the tooth. And you can see patients don't like it. It creates a little bit of a gap, which is visible, and it also kind of looks like they got food stuck in their teeth. Black triangles arise after patients have crowding and have their teeth moved. It can really frustrate the patient and the dentist because when the patient comes in, the dentist is thinking that they're done with their orthodontic treatment. The patient says, well, I don't really like these gaps and I want to close them with Invisalign. But the thing is, it's not really from ortho. It has to do more with the shape of the tooth because the tooth is very tapered. And so when you have a tapered shape here, the tooth is technically touching down here. And so it creates, thus the name, a black triangle. It could be very challenging to close it tighter with anything ortho because it's already touching down here. You have a few options to do this. Option one is some doctors do like a little what's called IPR, interproximal reduction, and they kind of like shave right here, which then creates a bigger space, but then it makes the space more even in which we will be able to close. Traditionally, I don't like to do that because especially on the front teeth, it's going to affect the shape. You don't want to have like a really blocky tooth when you get rid of it. The tooth will look flat, it won't look natural, but also it won't match its counterparts. Second is you can use composite resin, and sometimes I do a really conservative layering technique where I basically just add some composite or resin in here and add it in here. So we don't drill or take anything away, and we just kind of layer it in this way, the front, but then it kind of, we can push it through and wrap it around to the back. And in certain cases, especially like smaller black triangles, that's a really good solution. It's cost effective. The patient will like it and be super, super happy. In this case, decided to do a little bit more and we used some ceramic. And the reason why we did that is really for three main reasons. One is the patient has a little bit more higher aesthetic demands, meaning he really wants to improve his smile overall and not just close the black triangle. The reason why he has some high aesthetic demands and wants to do things a little bit more is because you'll see there's a little bit of some chipping here. The edges are a little uneven. And also from a shake perspective, this is pretty narrow. This does not match this, and this one's a little bit bigger and misshapen compared to that. If we use ceramic, we can get a little bit more balance as a whole. The third reason why we're doing the ceramic is because if you look at his teeth from the wear and tear, in addition to the chipping edges, you're gonna see a lot of cracks forming on the enamel. And the reason why that's a big deal is because if you took this tooth and turned it on the side, it kind of looks like this. And enamel is a very thin outer shell, kind of like an M&M. And inside the tooth, you have the softer, more sensitive tooth structure, and then you have the nerve inside the tooth. And so when you have these cracks, the problem is it can get bigger and deeper into the tooth over time, which could eventually lead to tooth sensitivity, tooth staining, tooth discoloration, etc. And in some cases, it can lead to tooth pain if it gets close enough to the nerve. The ceramic, the nice thing about it is it's going to seal those cracks in and help prevent that from getting worse. So really using ceramic, in my opinion, is kind of a win-win-win here. And so you're going to be able to see after we do a conservative plan of just 4 teeth in the front, which was his chief complaint, and truthfully all he really needed, we were able to get a really nice aesthetic result for the patient, get a really nice balanced look. We were able to kind of reshape the teeth, a little bit more additive or a little bit bulk in this area to like recontour the tooth, which then fully closes all the black triangles, as you can see from the side shot too. Still creates something that looks natural, but also helping protect the teeth from future issues.